Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover rotator cuff syndrome. Rotator cuff syndrome is not one single condition, but it is an assortment of conditions. It includes Subacromial Impingement Syndrome, which I did a video on previously. I will put a link to that video in the description box below. It also includes bursitis and rotator cuff tendinopathy. It can also include rotator cuff tears, full tears, and partial tears. So there's a lot included in rotator cuff syndrome. Rotator cuff syndrome is a condition that affects millions worldwide. It is generally equal in males and females, and there are two general groups that get this condition. The first group is the younger athletic group, the overhead throwing athlete. Think about baseball players who are constantly throwing overhead, and volleyball players and tennis players who are constantly serving overhead. So they suffer from repetitive type of an injury. And then the second group is the older group. This is an age-related injury. As people age, they are more likely to suffer from rotator cuff syndrome. I'm going to go over the anatomy and the physiology of the rotator cuff. The rotator cuff consists of four muscles. These muscles attach the scapula to the humerus. The scapula is the medical name for the shoulder blade. The humerus is the medical name for the upper arm bone. There are three posterior rotator cuff muscles: the Supraspinatus, the Infraspinatus, and the Teres Minor. These muscles originate on the back of the scapula and they attach to the humerus. Then there is one anterior rotator cuff muscle. This muscle is the Subscapularis. This muscle originates on the front of the scapula and attaches to the humerus. These muscles function to initiate motion in the shoulder. These motions include external rotation, internal rotation, and abduction. Abduction is raising the arm to the side. External rotation is turning the arm backwards, and internal rotation is turning the arm forward. So these four muscles help to initiate that motion. They also work as dynamic stabilizers of the glenohumeral joint. The glenohumeral joint is the joint where the humerus, again, which is the upper arm bone, connects to the scapula. The area that it connects to is called the glenoid fossa, or the glenoid cavity. That's where the name glenohumeral joint comes from. So again, these four muscles act as dynamic stabilizers of the glenohumeral joint. The symptoms of rotator cuff syndrome obviously depend on which condition exists, but the general symptoms include pain in the lateral or posterior aspect of the shoulder. Pain is usually worse with overhead activity. It can be with sports or just if you are reaching overhead. And it also is usually worse at night when you're trying to sleep on that side. Usually in rotator cuff syndrome, the active range of motion, the pain-free active range of motion, that is how you move the shoulder, is limited due to pain. Usually the passive range of motion, which is when someone is doing the motions for you, is not limited. Or it can be limited, but not as much as the active motion is limited. This condition can occur acutely, meaning there can be one trauma to the area, or it can occur in a chronic fashion. The chronic fashion is what I mentioned when people are older and it is age dependent, but the acute can be if someone just suffers an injury to the shoulder, to these muscles or to the tendons of the rotator cuff. That is a condition that you have to seek treatment immediately. Do not hesitate. If you have limited range of motion, severely limited range of motion due to pain, then see a medical professional immediately. If you start to feel symptoms in the posterior lateral shoulder and they progressively get worse, if it has an insidious onset, seek professional care. Do not wait. because if you have the acute injury, you want to get it taken care of as quickly as you can. If you have the chronic type of an injury, which has the insidious onset of symptoms, which have gradually progressed, you want to seek medical care. Myself, as a doctor of chiropractic, I have treated many patients with rotator cuff syndrome. When I treat someone with rotator cuff syndrome, first of all, the evaluation, I'm going to look at the shoulder itself. I'm going to look at the surrounding joints, the cervical spine. I'm going to look at the thoracic spine, which is the medical term for the mid-back. I'm going to look at how the scapula moves on the rib cage. I'm going to look at how the AC joint moves. That is the acromioclavicular joint where the collarbone meets the scapula. You want to see how the scapulothoracic joint moves, because everything plays a part in rotator cuff syndrome. The entire chain, what we call the arm trunk mechanism, must be evaluated and treated. If I treat someone with rotator cuff syndrome, there are many things that I could do. Like I said, I already mentioned that I would evaluate the cervical spine. The cervical spine, by the way, is the medical term for the neck. I'm not sure if I said that already. And the thoracic spine is the medical term for the mid-back. We want to make sure that they are both functioning properly. We want to look at the posture and the positioning of the neck and the thoracic spine and the shoulder blade and the shoulder. Look at this condition and see how the patient's posture is, because many times if a patient has poor posture, if they have a condition called scapular dyskinesis, which I did a video about and I will provide a link to that video. If they have scapular dyskinesis, which is an abnormal positioning or an abnormal motion of the scapula, that sets someone up for rotator cuff syndrome. So you want to make sure that these areas are evaluated when you seek professional care. As for the treatment, I will look at the neck, the mid-back, the shoulder, the entire shoulder complex. Like I said, there are 4 joints in the shoulder: the glenohumeral joint, the scapulothoracic joint, the sternoclavicular joint, and the acromioclavicular joint. All these areas have to be addressed, and the muscles have to be addressed also. Speaking about self-treatment for rotator cuff syndrome, there are numerous things that you can do. First of all, prevention is key. You want to make sure that you are not overtraining. You want to make sure that you are getting adequate rest between training sessions, and you want to make sure that you are using proper technique with whatever activity that you are using. You want to make sure that you develop proportional strength in the shoulder, that you are working the muscles in the back part of the shoulder, making sure that they are strong and making sure that the scapula is stabilized and that the rotator cuff muscles are stabilized. So you want to strengthen the muscles that retract the scapula. These are the rhomboid minor, the rhomboid major, the middle aspect of the traps, and the lower aspect of the traps. Retraction of the scapula is when the inside border, the medial border of the scapula is pulled towards the spine. If these muscles are strong, it helps to stabilize the scapula and puts less pressure on the rotator cuff muscles. But you also want to strengthen the posterior rotator cuff muscles, and you want to strengthen the posterior head of the deltoid. That will help to prevent rotator cuff injuries. If you have symptoms of any of the rotator cuff syndrome conditions and you have sought professional care and you got the correct diagnosis, then you could usually start self-treatment immediately. What I mean by that is performing your rehabilitation exercises. You want to stretch the muscles in the chest, the pectoralis minor and the pectoralis major, and stretch the latissimus dorsi muscle and the teres major muscle. Stretching these muscles helps to have less pull on the shoulder, pulling the shoulder into a forward position. You want to strengthen the scapular retractor muscles, you want to strengthen the posterior rotator cuff muscles, and you want to strengthen the posterior deltoid. Develop a proportional strength in the shoulder. You also want to start using isometric exercises. If you have limited pain-free range of motion due to this condition, then you could start with isometric exercises. The isometric exercises such as isometric scapular retraction will help to develop strength in the scapular retractor muscles and will help to stabilize the scapula when you are performing the other exercises. And then once you can advance to the isotonic exercises, these are the motion exercises, begin very gradually and increase the intensity in small, gradual, calculated increments. Several exercises that you can perform are what are called the YTWL exercises for the rotator cuff. I have a video on that. I will provide a link to that series of exercises, but these are exercises directly targeting the rotator cuff muscles, the posterior deltoid, and the scapular retractor muscles. This is a very important exercise to do. It will help you develop strength in the rotator cuff muscles. Whenever you are performing any type of exercise, but especially when you are performing rehabilitation exercises, you want the motion to be slow and controlled. And you want to control the eccentric phase of the exercise. Thank you for watching today's episode of Dr. Ozello's Sports Medicine Report, where I covered rotator cuff syndrome. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comments section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. If you are watching this video, then you are on my YouTube page. Always, always, always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your goals.